Welcome back to this final video on cardiovascular physiology. And in this one, we're going to look at the body's peripheral and central regulation of your blood pressure. We're going to try to put a whole bunch of concepts together. So short-term blood pressure regulation occurs in our body. It's almost second by second. It's every few seconds your body is doing this. And so one of the most important components for this are these mechanoreceptors, which are sensitive to stretch, that we call pressure receptors or baroreceptors. So baroreceptors are measuring how much stretch is going in to the walls of some specific arteries. And where these are located peripherally, we're going to learn about, there's two big areas. And so they are put in parts of your body where they can monitor the blood flow to the brain from the heart and to the body from the heart, because this is what it wants to control. So at normal blood pressure, these baroreceptors are firing at a regular rate. Now, if there is stretch that occurs in either one of these locations, the amount of firing, the signals are going to increase. Whereas if there is very low amounts of stress, low blood pressure, then the amount of signaling slows down. And so the peripheral receptors are giving us information, which then is going to go to central receptors, which is going to make decisions on what needs to happen, once again, peripherally. So the locations of the baroreceptors are in the walls of the arteries, specifically the aortic arch, and in something known as the carotid sinus. So the carotid sinus is this widened area at the most proximal portion of the internal carotid artery, right after the carotid arteries bifurcate. And so these are monitoring for stretch and sending information back to the brain, specifically the medulla oblongata. So from the carotid sinus, we are going to have the ninth cranial nerve, or the glossopharyngeal nerve, have signals going up. And from the heart itself, it is going to be the vagus nerve. Remember, the vagus nerve is the only cranial nerve that goes below the level of the lower neck. So that's why it cannot be the glossopharyngeal nerve for that. But the carotid bifurcation occurs just below the angle of your jaw. Do not be rubbing on it, because then you're going to be giving weird messages and you're going to have some physiological effects which could be detrimental to your health. So just don't do that. So once we have the 9th and 10th cranial nerves have their messages, they go to an area in the medulla oblongata, specifically the nucleus tractus solitarius, but you don't need to know that name. And depending on those, we can have inhibitory signals, which go to one area, which is going to give us some sympathetic effects, or we can have excitatory stuff, which is going to go and give us some parasympathetic effects. So as I said, these are stretch receptors. They're going to be directly correlating with mean arterial pressure and that firing. So if we have increases in mean arterial pressure, that means we're going to inhibit our sympathetic input, and we're going to increase our parasympathetic input. And if we have decreased firing or lowering pressure or decreased stretching, then we are going to stop inhibiting your sympathetic. In other words, increase our sympathetic activity, and we are going to decrease our parasympathetic activity. So your body, anytime your blood pressure is between about 60 and 180, it can do these changes minute by minute, every 30 seconds. It's getting the input every few seconds, and it's sending its output back down. So within a minute, you can have a major change in your blood pressure. So to try to pull all kinds of things together, let's do a concept map. Okay, it's not really a concept map. It starts as a concept map, but then it kind of goes into a flow chart. So you can call it whatever you want. In other words, we're putting stuff together. So for this one, think about those sensors in the carotid center and the aortic arch, and they're going into the medulla oblongata. And for the start of this flow chart, okay, so that part's the concept map. Okay, now for the start of this flow chart, the blood pressure has fallen. So think, what is going to happen in those sensors and what is going to change in the medulla oblongata, in that neural integration center? Okay, so based on that, you would probably say, yes, I could see some vasoconstriction occurring to try to raise the blood pressure, or cardiac stimulation to occur. Okay. Now, based on that, we have to have effectors. In other words, we have to have arteries and veins constrict. And for cardiac stimulation, we're talking two different factors: increasing the heart rate as well as increasing the stroke volume itself with some contractility going on. Now, what is going to happen here is that vasoconstriction will increase our peripheral vascular resistance, and the stroke volume and the heart rate, if they both go up, that increases our cardiac output. Now, of course, when this happens, you are going to have some negative feedback, as evidenced by this little red line back up in there, give some cardiac inhibition. But I just want to ignore that. And I just want to continue this on its pathway to see what happens as a result of increased peripheral resistance and increased cardiac output. Well, blood pressure is up, and whew, you have survived to move on to a new chapter. So once again, I know cardiovascular physiology can kind of confuse a lot of students, and I know there's a lot of moving points, but hopefully by taking 2 weeks to go over this material, or taking a long time to go over this material, that you have had a chance to put it together bit by bit and you understand all the moving parts. So thanks once again for all your hard work for this class, and I'll see you in class soon.